Many of us who take care of children have seen an increase in whooping cough to the severity where children require hospitalization. And there have been over 900 cases documented in the state of California this past year compared to about 200 cases the year before. And those 900 cases, unfortunately, have resulted in a number of children requiring significant hospitalization in intensive care units. And seriously, unfortunately, 4 patients have died. Pertussis should not be taken lightly. It's a life-threatening disease, especially in young infants and children, when they present in severe respiratory distress. And these children should be seen immediately, and decisions made about where they should be hospitalized, usually in an intensive care unit, where their vital signs and oxygenation can be monitored continuously, and interventions done if the child needs any more support. The difference between pertussis and the common cold can be quite obvious and quite profound for the young infant. Unlike a common cold, which will last maybe a week with a runny nose, low-grade fever, and a cough that goes away on its own and caused usually by a virus, pertussis and whooping cough is caused by a serious bacteria that invades our respiratory system, and it undergoes 3 phases of symptoms. The first phase can present like a common cold with a cough, low-grade fever, and a runny nose. The child may have some difficulty eating, but usually they get over that phase fairly well. It's the second phase that produces the life-threatening symptoms and the whooping. This is when the bacteria have completely invaded the upper respiratory tract. It's affected the lining of the tissues of the trachea, the windpipe, and the child has a very difficult time breathing. So the breathing is described as labored, increased respiratory rate, there are noises, and there can be this whooping cough, which is spasms of coughing as the child tries to clear these secretions and is having a very difficult time doing that. In addition, during this phase, the child may work so hard that their breathing stops. This is a very serious condition and requires immediate attention. The last phase of pertussis is the convalescent phase, where as the tissues are healing, the child has improvement in symptomatology, less coughing, less fever, and there's resolution. These 3 phases may take many weeks to resolve, unlike the common cold, which is usually gone in a week. Parents should be concerned whenever an infant presents with respiratory symptoms of coughing, runny nose, low-grade fevers, and those children should be seen by their physicians, either in the emergency department or in the office setting, and the physician should determine what other tests need to be done. It's really important to make sure the child is maintaining hydration, is able to eat, and keep the feeds in their intestines and absorbed so they don't become dehydrated. It's very important the child does not need supplemental oxygen. Those would be the criteria to admit the child to the hospital: need of oxygen, difficulty maintaining hydration. So if the parent is at all concerned about the respiratory pattern, the child should be seen. Clearly, if the infection is detected early on, antibacterial agents have a better chance of decreasing the bacteria in the airway. But as whooping cough progresses, it can cause serious injury to the airway, the breathing tubes, and the child then has more difficulty with respirations. And antimicrobial treatment at this point, medications, are not as helpful as they are earlier on. Thus, it's very important when you have symptoms and you have older children in the house who may not be adequately immunized, and this young infant has the symptoms, they should be seen by their physician. It is very important that all children be immunized appropriately for pertussis protection. They can harbor the bacteria as they get older. They're inadequately immunized. They can actually get infections with pertussis, similar to whooping cough in young infants, but because of their age, they don't become as symptomatic. And this is not limited to just older children, but also adults can also harbor the bacteria and pass it to young infants. So therefore, it is critical that everyone be appropriately immunized for pertussis. I'm Dr. Laurie Frankel, and now you know.